Assalamualaikum. Good afternoon, everyone. How are you? I hope you are well and healthy always. Okay, today our group 7 will do a presentation with the theme medical vocabularies. Before we saw our presentation, let me introduce my team. I'm Zihan Carrera as moderator. And next reader slide presentation is Al-Hafiz Dirgantara, Ashura Jihan Syamimi, Haya Ulia Afifah, Laksmi Anggrisa, Valentina Dini. Okay, to first reader slide. Welcome to Al-Hafiz Dirgantara. Next slide. Izin slide-nya tidak gerak.
Okay. Definition: vocabulary is a set of words that are known to one person of another entity and are part of a particular language. Medical is a media related to the healthy sector, so medical vocabulary is what related to the health field. Next.
Okay, function. Number 1, can read and understand medical terms. Number 2, can improve medical data processing capabilities. Number 3, improve service and presentation of medical records or health information. Number 4, increase vocabulary in the field of health. Number 5, improve the ability to learn medical vocabulary. Next.
Examples: 1. Disease in or penyakit dalam, a patient with internal disease. 2. Arthritis or radang sendi, he is a specialist in arthritis. Next. 3. Convulsion or kejang, patients who are having shock due to hay fever. Next.
Okay, next reader slide to Laksmi Anggrisa.
Examples: drug administration, pemberian obat, nurse giving medicine to patient, infusion installation, pemasangan infus, the nurse is doing the infusion.
Example: boys memar, a young girl is suffering in a hospital, bruising and bitten. Blister melepuh, I have been bruised and burned, knock, unicorn. Next. Example: bandage, perban. Bandage can be used to cover wound. Next. Language focus question. Mr. Arman has a bruise on his knee. What action should Mr. Arman do? Yang kedua, if the infusion can be done by hand, which part do we do instead? Number 3, mention someone of administering drugs. Next.
Language focus, grammar focus. One simple present tense. Disease in or penyakit dalam, a patient with internal disease, arthritis, radang sendi. He is a specialist in arthritis. Convulsion, kejang, patient who are having confusion due to high fever. 2. Present continuous tense. Drug administration, pemberian obat, nurse giving medicine to patient. Infusion installation, pemasangan infus, the nurse is doing the infusion. Brush memar, a young girl is suffering in a hospital, brush and beaten. 3. Present perfect tense. Blister, melepuh, I have been brushed and burned, now unconscious. Bandage, perban, bandage has used to cover wounds. Next.
Okay, next, vocabularies. Vocabulary, brush, part of speech, noun, meaning memar. Yang number 2, burn, part of speech, noun, meaning terbakar. Number 3, knock, unconscious, part of speech, noun, meaning pingsan. Number 4, arthritis, part of speech, noun, meaning radang sendi. Number 5, specialist, part of speech, pronoun, meaning specialist. Number 6, disease in, part of speech, noun, meaning penyakit dalam. Number 7, convulsion, part of speech, noun, meaning kejang. Number 8, drug administrating, part of speech, verb, meaning pemberian obat. Number 9, infusion installation, part of speech, verb, meaning pemasangan infus. Number 10, bandage, part of speech, noun, meaning perban. Number 11, blister, part of speech, noun, meaning melepuh. Number 12, knee, part of speech, noun, meaning lutut. Number 13, injection, part of speech, noun, meaning injeksi. Number 14, painkillers, part of speech, noun, meaning obat penghilang rasa sakit. Number 15, orally, part of speech, verb, meaning pemberian obat melalui mulut. Number 16, topical, part of speech, verb, meaning pemberian obat oles ke kulit. Next slide. Reference. Okay, that's enough presentation from our group 7. Please, for other group who want to ask question, to turn on the mic and open camera. Thank you. What action shall Mr. Arman do?
Excuse me, Jihan.
Excuse me.
Okay,
Excuse me,
I
Jihan.
would like to answer the question. First, my name is. My name is Lina. I would like to answer the question from slide limit focus for the question number 1. With question, Mr. Arman has a bruise on his knee. What action should Mr. Arman do? And my answer is, a person may wish to treat a bruises knee at home with the RICE approach. This involves 1. Resting the knee joint. 2. Cooling the area with a compressed or ice pack wrapped in a towel for 20 minutes at a time, several times per day. And 3. Lightly wrapping the knee in a soft bandage. 4. Elevating the knee above the level of the heart, if possible, to prevent blood from pooling. And remember to not apply ice directly to the skin or try to drain the bruise of blood using a needle. If there is a large lump that does not decrease in size after several days, a doctor may need to drain it. This is my answer, Jihan.
Okay, thank you for the answer given by Cindy Aprilina. The answer is right. Thank you, Cindy.
Excuse me.
The next question, number 2. Okay, Nunung.
I'm Nabila. Will answer 3 questions.
Okay.
Applied in effort for not being too able open the camera. 3 are 6 ways of offering medicaments. The first is oral. The second is perinatal. The third is sublingual or buccal. The fourth is tropical. The fifth is suppositorious. And the last is drops. It is true, Zihan.
Okay, thank you for the answer given by Nunung Nabila Husnul Khotimah. The answer is right. Thank you, Nunung. Okay, question number 3. Mention some ways of administering drugs. Please to...
Excuse me, Zihan.
Okay, Ega.
I will answer question number 2. My answer is feet. If the hand can, then the feet are instead.
Okay, sorry, there is a network problem. Thank you for answering question number 2 by Ega Puspitasari. And that's enough presentation from our group 7. Sorry if there is an error. Continue with the next group. Thank you.